performing wound care for my patient. So the first thing I would do is I would wash my hands and go into my patient's room after checking to see that there's a provider's order for wound care. So I would come in and knock knock, my hands are washed, and I would ask the patient if I could see their armband. So I would say, can you identify your name, date of birth, and do you have any allergies? So they identified all of that, they don't have any allergies, and then I would ask them to rate their pain on a scale of 0 to 10. So if they did have any pain, I could check the MAR and see if I could give them medication prior to me doing wound care, so that way they're not in pain. So I would check, I can give them medication, I would give them the medication, and then I would come back 30 minutes later. So it's been 30 minutes, come back in, my hands are washed again. I would ask them to identify their name, date of birth, and any allergies again, and I would ask them I would reassess their pain scale. So they're saying that they're feeling better, they don't have any pain, so we can go ahead and get started. So I would explain the procedure to my patient, raise the bed up, and I would pull the curtain for privacy and make sure that they were in a comfortable position. So after I did that, I explained the procedure to my patient. So I have them in a position, the pillows are underneath of them where they're comfortable and it's a comfortable working height for myself. So I would put on my PPE, so I have that down here, and then I am going to go ahead and get started. So my hands are washed and clean, so I would put on my clean gloves, and then my patient would have pads and gauze inside. So right now, just in the pretend world, he does have the ABD pad and the 4x4s inside. So the first thing I would do is I would hold the ABD pad. If there was tapes, that way the skin wouldn't be irritated, I would remove that, and then I would count each of the 4 gauze pads. So then after I removed all of that, I would note that I removed the ABD pad and 4 4x4s. So then I would look at that and note the drainage, the coat, the color, the odor, the amount, and the type. So I would note if it was scant, moderate, or copious. I would note if it was sanguinous, serosanguinous, serous, or purulent. And then after I did that, I would dispose of that according to my agency's policy in the waste bin. And then now I'm just going to assess the skin surrounding the wound. Just check for any presence of granulation tissue, necrosis, slough, eschar, undermining, tunneling, and I would assess that. Want to see granulation tissue indicating that the wound is healing. So I have noted all that, and then I'm going to get ready for my sterile procedure. So I would remove. So before I remove my gloves, I have to measure the wound. So I have my pad underneath, so I'm going to measure the length, width, and depth of the wound. So length will be from head to toe, and I'm going to be careful not to touch the skin with it. So that's about 2 centimeters in length, and then width, about 2.5 centimeters. And then I'm going to take my sterile, or my cotton tip applicator, and I'm just going to put that in right before the skin, making sure that I don't touch. Okay. And I'm just going to measure that. And then that's about 2 centimeters as well. So that's all measured. I will note all of that, and then I'm going to get set up for my sterile procedure. I'm going to take off my gloves and then wash my hands. So after I removed my gloves, I'm going to set up my sterile field. So my drape is inside of here, so I'm going to be careful not to touch the inside. Pull that back. So my table is clean, dry, and waist high. And I'm just going to get the drape out. Touch myself. Just touching the outer 1-inch border. So now I'm going to set everything up on there. Be careful not to touch the inside. And then I'm going to take my normal saline and I'll check the expiration date. Since it already has been opened, it was opened less than 24 hours ago. So I'm going to take it and then I would lip the bottle. I'm going to pour some into both trays. And now my sterile field is ready and I'm going to get on my sterile gloves. So I can fix that after I get this gloves on. So now I'm sterile, and now I'm going to irrigate the wound. I'm going to take my bulb syringe. Knock over my sterile field. And I'm not going to hold it directly on there, I'm just going to hold it at the side, and I'm going to be careful not to get it on the surrounding skin. I'm just going to irrigate until it runs clear. And it's clear. So I'm going to come back around. Be careful not to ruin my sterile field. That's done. And then I want to dry that out before I collect my culture swab. So I'm just going to separate these a bit. So I'm going to take this gauze, I'm going to fold it in half. And I'm going to be careful not to allow my hands to touch the skin. And I'll dry that about halfway. And then I would be done with that. So now it is dry, enough for me to collect my sterile swab. So I'm going to take it, remove the cap. So the cap is still sterile. So I'm going to take my swab. I'm going to come over and I'm just going to swab, circle around the best part of the wound that I think we could get a good culture. And be careful not to touch the inside or the outside. I'm gonna come back over and put the cap on. So then after I did this, I would label it with, so this is still sterile, I would label it with the location, so the abdomen, the date, time, and my initials, and then I would send that down to the lab with the requisition form labeled with the same things. So now that I have obtained my culture, I'm going to redress the wound. So I'm going to take some of these, full film, and I'm going to put them in my solution here. So I no longer need to stay sterile anymore. So I'm just going to squeeze excess water, or the saline solution, and just fluff it out. And then I'm going to pack the wound. I'm going to need one more. Fluff that. That's also gonna go. So I'm gonna note that I put 2 4x4s inside of the wound, and then I'm going to make sure the surrounding area is dry. And then I will redress the wound. So these would go on the outside. 2 4x4s, and then the ABD pad. I'm going to secure that with my tape. And on my tape I will put my initials and the date and time. So then I would secure this. I would do all 4 sides on an actual patient. So that's secure. So then the wound is redressed as it's labeled with the date, time, and my initials. And I can now clean up everything. I can take this out from underneath of them. So I would just ask my patient, how are you feeling? Are you okay? And I would then document that I performed wound care. I would document what I got out of the wound when I first assessed it. So the 4 4x4s, and I would document the coat, the color, odor, the amount, and type of drainage. I would document the skin surrounding the wound bed. I would document that I irrigated the wound, that I performed wound care, how they tolerated the procedure. I would also document that I redressed the wound with 2 4x4s inside, 2 4x4s on the outside, and then an ABD pad, the date, time, and then I would send my culture to the lab, clean up, put the bed in the lowest position, call light in place, and then I would take off my gloves, perform hand hygiene, and patient would be good to go.